Arizona, right now, we need more nurses, and that is the message from hospitals across the valley.
They say hiring healthcare workers has been an ongoing challenge during this pandemic. They have more than 1,000 openings as of tonight. Kiara Hayes on this story. And Kiara, Governor Ducey announcing he's going to give money to the hospitals trying to hire these nurses.
Yeah, exactly. The governor will give out $60 million to hospitals trying to fill those positions. But there are some requirements. First, the hospital has to offer a certain type of COVID treatment, and they need to offer a COVID vaccine for patients that get released.
We are experiencing staffing challenges.
A statement heard consistently from hospitals across the state since the beginning of the pandemic.
You know, for example, I have another probably 12 to 13 ICU beds I could open if I had additional nursing and support staff to be able to do that. And that's just one unit.
Dr. Michael White works for Valleywise Health, and right now they're trying to fill 150 positions.
Staffing continues to be our biggest area of opportunity.
As of last week, Banner Health officials say they had 1,000 openings, and that's just for nurses. To help, Governor Doug Ducey announced he is setting aside $60 million to help hospitals with staffing shortages. But there are two requirements. The hospitals must offer monoclonal antibody treatments and offer COVID vaccines to patients they release.
So we have had some success.
Dr. Smith says Valleywise has offered monoclonal treatments for months. You may remember the antibody treatment was famously used for former President Donald Trump when he contracted COVID. Dr. White says the man-made protein created to act like an antibody is proving to be effective in reducing the number of people in the hospital with COVID.
This is something you should discuss with your healthcare provider. Should this be something that you're eligible for and be sent to get?
But Governor Ducey is drawing criticism tonight, with some comparing this program rollout to one last month that will give schools more funding for students if they do not have a mask mandate. A spokesperson with the governor's office says this is the third time the state has helped hospitals with staffing, and each time the money has come with requirements.
There are a few things to note when it comes to the monoclonal antibody treatments. Now, in order to qualify, you have to be at least 12 years old. You must be considered high risk and have shown COVID symptoms in the last 10 days. In the newsroom, Kiara Hay, Arizona's Family.